In today's day and age, there is increased availability of over-the-counter herbs, supplements, and even medications that do not require a physician's prescription. Even though these supplements and medications are FDA approved, the general population is not educated about how to use these products as directed and the potential side effects. The case that will be discussed below signifies the importance of thorough history taking, which should include collateral history in patients with documented or risks of dementia, and the need to educate patients about over-the-counter products. The patient is a 74-year-old male with past medical history of ataxia and dementia secondary to Fragile X syndrome, who presented to ED with fatigue, loss of appetite, and lack of interest. He reported that when he sleeps, flies and other insects enter his body through his mouth, and that he can feel these insects flying around in his chest during the day. He also endorsed watery diarrhea for several weeks now, which he noted is flushing the insects out of his body. He denied nausea, vomiting, fevers, abdominal pain, or dizziness. In the ED, patient was afebrile and vital signs were notable for a blood pressure of 83/72 and a heart rate of 76. Physical exam showed a man in no acute distress, with known hand tremor and dry mucous membranes. Pertinent labs included a potassium of 5.4, serum creatinine 6.27 from his baseline of 1, BUN 70, bicarbonate 8, venous pH 7.1, NN GABA 14, and a magnesium at 3.6. EKG without ST or T wave changes, and his chest X-ray was unremarkable. The patient was started on continuous bicarbonate infusion for the metabolic acidosis in the setting of intestinal bicarbonate loss, and intravenous fluids for hydration with improvement in his blood pressure. The diarrhea was of unclear origin, and the patient was afebrile and stool testing was negative for infectious etiology. The patient denied use of laxatives. Further history from family was obtained and revealed the patient had been taking 3 to 4 tablespoons of Epsom salt per day for multiple weeks to alleviate the jittery sensation in his chest. The patient's kidney function and metabolic acidosis improved with bicarbonate and intravenous fluid infusions. He was referred to a neuropsychiatrist for management of hallucinations in the setting of dementia, and he was advised not to ingest Epsom salts. This case illustrates the development of severe metabolic acidosis secondary to diarrhea when ingesting Epsom salt, also known as magnesium sulfate, which is readily used nowadays in bathing water to relax muscles and loosen stiff joints. It is actually FDA approved for constipation, but the recommended dosage is 2 to 4 teaspoons daily. It is not recommended for chronic use given the risk of developing high magnesium levels, as can be seen in this case. Very high levels of magnesium can lead to cardiac arrhythmias and muscle paralysis. There are 2 main learning points in this case. The first one is the importance of a thorough history of the presenting illness in order to determine the etiology of the presentation. This should include collateral history in patients who have a history of dementia, memory loss, those at risk for developing dementia, and anyone who presents with altered mental status, whether it is acute or chronic. It also emphasizes the importance to educate both physicians and patients on over-the-counter medications, supplements, and chemicals, as the availability and diversity increases rapidly. Over-the-counter drugs do not require a prescription from a physician or contact with a pharmacist. Even though most over-the-counter drugs are safe when used as directed, many people do not read the directions properly and are at risk for detrimental side effects from overuse or when combined with other over-the-counter drugs. Multiple studies that have been published in the past decade have shown that many people using over-the-counter medications are not aware of the maximum daily dose of these drugs or their potential side effects. It is therefore important that physicians ask about over-the-counter drug and supplement use during office visits and inform their patients about appropriate use and potential side effects. Though not necessarily part of my presentation about over-the-counter drugs and supplements, I did want to share some information about Fragile X syndrome and its association with psychosis, which was the reason the patient in this case overused over-the-counter chemicals. Fragile X syndrome is caused by expansion of the CGG triplet to more than 200 repeats within the promoter region of FMR1 gene on the X chromosome. This expansion leads to methylation of the promoter, which therefore inhibits translation of the gene, resulting in lower, even absent levels of FMR1 protein, also known as FMRP. Classically, Fragile X patients present with intellectual disability and phenotypical findings of elongated face and prominent ears. Males can also present with macroorchidism. Psychosis is actually seen in less than 10% of Fragile X patients. Patients with a premutation, known as Fragile X-associated tremor and ataxia syndrome, have 55 to 200 repeats of the CGG triplet. They present at a later age with gait ataxia, dementia, and Parkinsonism due to elevated FMR1 mRNA, but do not have the characteristic phenotypical findings of Fragile X syndrome. If these patients have low but not absent levels of FMRP and elevated FMR1 mRNA levels, they are considered to have double hit and show features of both syndromes. Research has shown that patients with psychotic disorders have reduced nodal efficiency in the superior temporal gyrus. Patients with Fragile X syndrome have been found to have smaller temporal gyrus. I was unable to find studies that associate the smaller temporal gyrus in Fragile X syndrome to developing psychosis, but given this information, it may be a possible explanation.